Hi guys, a very good morning to all of you. Today we are going to talk about certain formula which are important for your Section 1 FRCS Urology exam. So when you prepare for your MCQs or single best answer questions, you can encounter at least one formula based question which from the core urology. So we are not talking about the statistics formula like your sensitivity, specificity. We had a whole separate video on that already. What we are going to talk about is the formula from your core urology, which can be put up as an MCQ. A very important thing that you should have a compilation. For the next 5 minutes, we're going to talk about 5 different formulas which are important for your single best answer questions. The first formula that you can encounter is your eGFR estimation. So your eGFR estimation, you can get a formula on your Cockcroft Galt, MDRD, or CKD-EP. Any of these formulas can be put up as a question. It's not that you don't have to memorize the formula here altogether. CG formula you can memorize. If at all you get a CG formula. But then for the other two formula, you need to know the components of this formula. Okay, you should know what are the components of MDRD, CKD-EP, what are the components of CG formula. These are very potential single best answer questions. Now, why this is, there is another question which is very potential to be brought up as your single best answer are your MDRD formula and how is it different from the other two as your components of the formulas are concerned. So if you look at this, this is taken from your Scientific Basis of Urology, which is a very important book for your section 1. If you look at this MDRD formula, two important components are these two. So if you go down, this stands for serum uric acid, and serum albumin. So serum albumin and serum uric acid are two important components in the MDRD formula, which probably is not present in the other two formulas, and that's why it's a very potential single best answer questions. Apart from that, you can already understand the components of CKD-EP or MDRD. The overlapping components are the creatinine, the race, the gender, and the you can see this the age of the patient as well. Okay, so know the components in detail. How the MDRD formula is different from the other two, and know the CG formula. If you have to calculate the CG formula for a female, you just need to multiply the GFR that you get by 0.85. Okay. The other formula, apart from the GFR estimation, which you will encounter is your fractional excretion of sodium. That's quite an important formula. Why? Because this will give you an idea. So how do you calculate it? You calculate it by the urine sodium into plasma creatinine, by urine creatinine into plasma sodium multiplied by 100. So you'll get a ratio. The ratio can be either less than 1 or more than 1. So this gives you an idea about the fraction of sodium which is coming out in urine. So you get an idea about whether it's a pre-renal failure or it is an intrinsic, like an acute tubular necrosis. It's a post-renal failure. Okay. So these are the situations which you can differentiate based on your fractional sodium excretion in the urine. And pre-renal failure will have a normal fractional excretion or a less than 1 fractional excretion because there is no problem with the glomerulus, no problem with the absorption and the excretory function of the kidney. It's only the dehydration or any pre-renal factor which is responsible for the renal failure or an AKI. So this is very important that you should be able to differentiate a pre-renal from a post-renal based on a fractional excretion, and you can get a formula-based question from this as well. Third is your bladder capacity calculation. And if you're solving the MCQs, you must have encountered bladder capacity based questions. And for example, if you have a child with a bladder trauma, child with a or any patient with a bladder trauma, you might have to calculate the amount of the contrast you need to instill. So in that case, you can just calculate by the one of the formulas, and one of the formula which is most commonly being used is the ICS recommendation, which is the age plus 1 into 30. Okay, this is there are different formulas for different age groups. Just know one formula, try to apply it, and I'm sure you're going to reach to the safest option in your SVS. Okay, so this is bladder calculation, bladder capacity calculation, and then when you're getting a urodynamic like scenario, for example, you might get a urodynamic trace. You might be asked to calculate the bladder outlet obstruction index and bladder contractility index based on the voiding phase of the urodynamics. And in that case, you will be given a PDAT at the Qmax, and you will be given the Qmax as well. And you have to remember the accurate formula, because if you don't remember that, you are going to confuse the options. If it is less than 100, it's a poor contractility. If it is 100 to 150, it's average contractility. And if it is more than 150, it is good or strong contractions. Similarly, for bladder outlet obstruction index, if it is less than 20, there is no obstruction. If it is 20 to 40, there is equivocal finding. And if it is more than 40, it's suggestive of an obstruction. Okay, so this is something which is very, very important. You will get, and you don't have time at that or your exam day to revise all this. So just keep this all assimilated together so that you can go through a quick revision for your exams. Okay, the formula from your urodynamics. Then the last one, this is the last one, which is based on your prostate markers. So you can get so you definitely, they won't ask you to calculate the PHI index for a particular patient based on the PSA or the -2 pro PSA. So it's not possible for you to calculate this, but then you should know the components of this. It's -2 pro PSA, PSA, total PSA, and the free PSA are the components of the PHI index. Similarly, they can ask you of the 4K score. So these are the FDA approved for PSAs between 4 to 10 or PSAs between 2 to 10 as per the European guidelines, even if there is a prior negative biopsy. So you can use all this in those dilemma cases where you can apply this additional markers. 4K score includes, so you can just remember it by the mnemonic thief. Okay, so it's a total PSA, HK2, intact PSA, and free PSA. Okay, so the thief took 4K and ran away. You can remember it this way: the thief took 4K and ran away. So the total PSA, HK2, intact PSA, and the free PSA are the components of the 4K score. Know the components. You will be getting questions on this, trust me. And we'll be having more discussions in the classes, and we are starting our classes again for the next session from January. See you soon in the classes, and all the best for your upcoming exams in January. Thank you.